Hi, thanks for watching our latest installment on the herpes virus and the treatments we do here at Rucker Integrative Medicine. I'm Dr. Rucker, and thanks for watching. I'm going to address three different areas today. One is an update on one of the patients. Secondly, it's a question from a prospective patient that I'd like to address. And the last is something new that I've been adding to treatments. So, first of all, if you've seen some of my videos, I talk about antibody titers and IgG. And one of the trends that I am noticing as we keep getting data is we are definitely seeing IgG antibody titers drop in our patients, and they're continuously dropping and approaching zero. So how low are the patients going to go? I don't know, but I think it's very significant and substantial that I'm seeing the antibody titers drop as we do treatments. So lately it seems like it makes a lot of sense to check the antibody titers every 6 weeks or 3 months if you want to really stay on top of progress. So the recent patient I had, we were at 32 IgG. That was 6 weeks ago, and 6 weeks later we check and it's 25. So one nice little tidbit, seeing how things work. So the question from the audience is, how do I manage or deal with the ganglia where the herpes virus is supposed to reside? So I received that question, and that was nice because I did have the opportunity to look through the literature. Very interesting studies from the 1970s, 1978. One of the studies, they did dissection of mice, which they gave herpes virus to. So that's a lot of the proof that it resides in ganglia and come from mice studies and rabbit studies. Absolutely, it looks like HSV1 likes to have the sensory ganglia that can occupy the facial nerves, trigeminal being one of them. And HSV2 prefers lumbosacral ganglia, and that's why lumbar and sacral nerves populate the genitalia, so that's why the outbreaks are there. So it does appear to be the virus likes to stay dormant, likes to stay latent in the ganglia, and then when it's activated it manifests in the skin of those areas. So the question is, how do I address it? First of all, our treatments for herpes here in the office use high doses of ozone and IV vitamin C. I have the highest degree of faith that these charge up the immune system and charge up cells like macrophages. And also, when I'm doing direct IV ozone infusion, it's getting into the smallest capillaries of your body. So, number one, it's directly attacking the virus even as it sits sleeping in the ganglia. Number two, patients who are having outbreaks, active outbreaks, I will treat subcutaneously the area of the ganglia directly. Or I'll treat the skin manifestations, whether it's in the perineum area, whether it's in the scrotal or vaginal area. The patients often grimace the idea of a needle in that area, but we numb things up and they're shocked how little it hurts. And then the last thing I want to mention is an additional powerful tool I've been adding for many different reasons in the practice, whether it's cancer, immune system, antiviral, is chelation. We're using the agent EDTA in our IVs because the chelation of heavy metals and toxins is a victory for the overall health of the patient, and apparently with research I'm noticing viruses love having heavy metals in the bloodstream. They use it to activate their system of trickery. So when I use chelation, I'm expecting to see wonderful results for my herpes and cancer patients and autoimmune patients. So thanks for watching. You know how to contact us, and we love having your questions so we can give you direct answers and feedback. Take care.